Hello, this is Mike Burdick, your host and producer of Krynytsia, The Well, a podcast series about interesting and notable Ukrainians from around the globe. Today is Tuesday, July 23rd, 2024. Our guest for this episode is Fedir Serdiuk, who is a Ukrainian entrepreneur, founder of the emergency medicine company FAST, F-A-S-T, and co-founder of the nonprofit Pulse. This episode of Krynytsia is produced for The Ukrainian Weekly, a newspaper published in English for the global Ukrainian community since 1933. Welcome, Fedir. How are you today?
Hello, I'm happy to be here. Thanks for hosting me here today.
Yeah, thanks for joining us today. To start off with, can you talk a bit about your educational and professional background?
I was born in Odessa, and my grandfather was a rector, so a CEO of Odessa National University in times of Soviet Union. He was a famous scientist. He was active in the area of experimental physics, educated in Stanford University in 60s. Literally when I was born in 1995, I already knew that everybody knew that I would join the same university, although he was unfortunately already not with us. I didn't take the STEAM track. I was always more interested in humanitarian sciences, so I decided to pursue a law degree. But my studies happened in quite tough times. It's funny to mention tough times. 2013, to call it tough times today during large-scale war, but it was a Yanukovych era. So I was not really optimistic about the rule of law, and I didn't really see any sufficient let's say motivators for me to stay in this career. So when Maidan happened and the first drips of blood was on the streets, unfortunately, when we had some street clashes there, I dropped from the university and joined the Red Cross, and my whole career was then dedicated to more or less to rescue and life saving. I graduated the university later, in a few years after all of my buddies, but I'm a certified lawyer, but I never practiced actually after.
So you mentioned getting involved in emergency medical care. Why did you decide to dedicate your life to emergency medical care and healthcare in general?
Well, it was a very impulsive decision in 2014 because I witnessed what happened in Odessa, the events of the 2nd May when 50 people died in the street fights, and also the violence in Crimea and in Donbass, and I wanted to be of help. So actually, I wanted to be a part of the solution, not part of the problem, not part of the witness, the lay people who are panicking and actually causing or becoming the victims of the violence, and people who have absolutely no clue how to help their society. So the most obvious idea was to join the Red Cross because a friend of mine, Taras Loganov, was a then Red Cross emergency response teams. He was a national coordinator, so he invited me to learn first aid. It was a very reactive decision in these days, but later I figured out that healthcare in general and emergency response in Ukraine is a huge problem. And I was very lucky to get to know some American folks who came here to train us, and I learned from them. I received a certification from California Emergency Medical Services Authority then, and I was educated also in the US with the Open World Leadership Program in emergency response, and took some other classes, numerous in the scope of this 10 years which passed. And the more I got trained, the more I saw, the more opportunities I saw to improve the care Ukrainian society provides to its patient. And I believed always that value of human life, security and safety and health is one of the core values to define the quality of the society. So I believe that it's impossible to have a free and decent society without decent and capable healthcare and emergency response system.
Dude, in the year 2021, you were included on a list of Forbes magazine's 30 under 30 group. Do you have any idea why you were chosen for that list?
Frankly, I think that this is so in my case, it was the second nomination for Forbes 30 under 30, because in 2020, I think I was nominated by Ukrainian Forbes to the 30 under 30 league. And in 2021, I was nominated to the Global Forbes magazine. So I think that they just wanted, so basically Forbes 30 under 30 is more of the symbol and expectations, not only significant trackable achievements, because many young people have trackable achievements, but not all of them are included to this list. They wanted to highlight the person from Ukraine who is focused on solving safety issues. I think it's more about this, because I already had some quite large for this area, for this sector of economy, business focused on first aid, emergency response, and healthcare, health and safety on workplace. So I think it was a symbolic nomination of the value of safety.
And when did you establish the emergency medicine company, FAST, and why?
It's an interesting story. We actually, for the first few years, we volunteered with my co-founder Igor Korpusov and the other guys who joined the Red Cross and then joined a separate, unnamed unit which was training military, which, by the way, Red Cross policy didn't allow at the time. So we established this second volunteer group. We still don't have any name for this, and we were in our 20s. I was in 2015, I was 20 years old. So we were in need of money. My parents are not, like in this song, I'm not the senator's son. I wasn't born with a silver spoon in hand. So we needed money, and we needed money to keep volunteering, because to travel, Ukraine is a large country, and to travel 500 kilometers to the military base and back, we need to cover the expenses of the gasoline, even though our work was free of charge for the military and nobody paid us. We also needed equipment. For instance, if we taught people to use tourniquets to control the bleeding, we terribly required the tourniquets, which at the time Ukrainian government didn't procure for numerous reasons. So we started to train civilians, and we received some payments. We paid taxes. It was from the day one our policy, and we actually directed first in the first years, like almost all our profits and then part of our profits to our own volunteering. So you can tell that it was some sort of social entrepreneurship, enterprise, let's say. But at the time, we didn't really know this term.
Please tell us about the nonprofit Pulse, which you co-founded. What is its main purpose, and how successful has it been?
FAST was created first to support our volunteering, and then we served numerous different companies all over the country and sometimes abroad with emergency response and health care and different services. But it required more and more of business approach. So we were perfectly comfortable having FAST as a private company. And our volunteering, we also didn't have any independent entity for this. So we just covered our own expenses for training, military, and so on. But when the large-scale invasion happened and Russia reinvaded Ukraine in 2022, the number of people, the amount of need was absolutely historical. It was a disaster. We needed to train on a basic level 100,000 of people every year, and we needed to provide quite a comprehensive and complex training for the doctors and the combat medics, people who require, and special forces, people who require deeper and more advanced skills. And with our profits, which became quite tiny in the first part of 2022, when the Ukrainian economy suffered severely from the invasion, we needed additional resources. So, for the sake of transparency, we established a nonprofit and we started fundraising mainly among our clients, but not only among them. And at the time, I cannot tell you the accurate numbers, but it's around like $1.5 million we received from our donors, and we trained roughly 30,000 of people in this 2.5 years. Part of these people received basic combat medical training from us. We are NAMT, US NAMT certified, so we train them in official way in the CLS, all service member, combat lifesaver, combat medic courses. But also we provide some comprehensive or complex training programs or scenarios like REBO, administration or blood transfusion. So Pulse basically was created to make this track of training military people independent, transparent, and successful. And so far, I cannot say that we are very successful because unfortunately, what we try to do is not to create anything new, but to prevent the loss of the most important and most valuable thing which our country has, the human life. So I cannot say we are successful if even one person dies with the Ukrainian flag on its shoulder, but we do whatever we can, and we consider ourselves to be probably the largest military medical training organization in Europe.
And what is the current situation with emergency medical care in Ukraine? How has it been affected by the Russian invasion?
It depends. As you know, Ukraine is the largest country in Europe, and we have numerous regions. But unfortunately, in almost 300 degrees of our territory, if you will take a look on the map, we are neighboring with quite wild and vicious neighbor Russia. So the regions like Sumy, Kharkiv, Donetsk, Lugansk is fully occupied, so I don't mention it. Kherson, Zaporizhia, Odessa. These regions are suffering from Russian attacks. They're suffering more even than Kiev region, which is also neighboring with Belarus. So we have worse situation in the sites which are affected by direct strikes. We have many people turn refugees, and unfortunately, some of these people provided the infrastructure for emergency response. And we have double tap tactics while Russia is utilizing ballistic missile to kill and injure the civilians and military people sometimes. And then the emergency responders who are on the scene, they receive the second strike. And this is Russian designated tactics to kill the responders, which is considered to be a war crime by any means. So this is part of the problem. The second part of the problem is the funding and also the human capital. You require bright minds to do development. And unfortunately, there is such a need in armed forces, such a need in private sector, in state-owned emergency medicine, and in privately owned emergency hospitals. So we are now in need for human capital. And last but not least, any country which is involved in the war for its survival, it will focus all of the attention, public funds, discussions, think tanks, everything, civil society, on military and defense. And I do not blame anybody. I understand why, but the emergency response, especially in the civilian setting, and the programs which are called to decrease the number of casualties, not only by treatment, but also by the prevention of deaths, like let's say motor vehicle accident prevention, they're not highlighted, and it's understandable. So we are doing much better than I expected us to do. We are saving lives, we are protecting, we are preventing trauma wherever we can, but we can do a better job, especially if we will be protected from terrible Russian aggression. And we will do a better job when we will receive all the necessary sources, or all the conditions would be in place.
Fedir, unfortunately, we're just about out of time, but I did want to ask you one final question. What are your plans for the future?
I'm living now in this state of serendipity. So if you will ask about my projects, they will they will have quite a detailed and professional planning, each of them. But if you ask about me personally, I am dedicated to continue helping Pulse in the role of co-founder to keep doing their great job. And I'm very grateful to the team. I'm very happy for Fast because Fast is expanding not only in Ukraine but globally with some of our products. But I am always I'm constantly looking for more things to do to decrease the human mortality. So my plans are to involve Western entities, Western people to work together closely to save the human lives in Ukraine and also learn the lessons from Ukraine and apply them to the allies of the West globally to save the people there in the potential areas of conflict.
If our audience wants to find out more about your emergency medicine company, FAST, and also about your nonprofit Pulse, where can they go?
We have Instagram as our main platform. We are not only fundraising there or reporting or sharing the news, but also we are educating audience. So even English speakers will find a lot of interesting stuff there. We haven't plans to start English speaking page, so please keep updated. But for the people who want to contact us to work together, I invite everybody to our websites, which I will kindly ask you to leave a link on in the newspaper and also in the digital version of our interview.
Yes, we'll include that in the description on this podcast interview.
I appreciate this very much.
Fedir, thank you so much for joining us today on Krynytsia.
The pleasure was all mine.
I have been speaking with Fedir Serdiuk, a Ukrainian entrepreneur, founder of the emergency medicine company FAST, and co-founder of the nonprofit Pulse. This episode of Krynytsia has been produced for The Ukrainian Weekly, a newspaper published in English for the global Ukrainian community since 1933. I'm Mike Burek, your host and producer of Krynytsia. Until next time, that's all for now.